Hello everyone and welcome to my YouTube channel. This is Dr. Naz and today I'll be discussing about cystic fibrosis. It is the most common fatal genetic condition in Caucasians and its inheritance is autosomal recessive. It means if the both parents are unaffected carriers, then there are 25% chances that their children will be diseased with cystic fibrosis. 50% children will be unaffected and there is 25% chance of having a healthy baby. Basically what happens is the gene on the long arm of chromosome 7 gets mutated, which codes for chloride channel known as cystic fibrosis transmembrane conductance regulator CFTR gene, and it influences the salt and water movement across the epithelial cell membrane. So when this transmembrane conductance regulator is affected, then there will be decreased or altered salt and water movement across the epithelial cell. This genetic defect causes increased sodium chloride content in sweat and increased resorption of sodium and water from respiratory epithelium. So when the sodium and water is more resorbed from respiratory epithelium, then the secretions of the respiratory tract, that is the mucus, it will be thick and sticky and it will block the airways. Also it happens in the pancreas, same thing. So the pancreatic secretions will also be thick and sticky and they will block the pancreatic duct. So you can clearly see in the picture that the airway is blocked with thick mucus, and this thick mucus can lead to bacterial growth and it will lead to bacterial infection. So sinusitis can occur and it will result in infection. Because of the same reason, lungs will be involved by thick sticky mucus buildup, bacterial infection and widened airways. The skin is involved, sweat glands produce salty sweat. So a parent may come to you and complain that when I kiss the baby I feel the sweat is extremely salty. The liver will also have the blocked and biliary ducts. Pancreas have blocked pancreatic ducts. Intestine cannot fully absorb nutrients, and reproductive organs, male and female, complications will also occur because of the same reason. Salty tasting skin, chronic respiratory problems, lung infections, poor growth and weight loss. Obviously, if the intestine is not absorbing the nutrients properly, then there will be poor growth and there will be weight loss. Meconium ileus can occur, bulky, greasy stools. So the clinical features include there will be recurrent pneumonia in the patients of cystic fibrosis because of recurrent bacterial infection, initially with the Staphylococcus aureus, then with the Pseudomonas. Recurrent bronchiectasis can also occur. Men are infertile due to absence of vas deferens. Complications may include respiratory complications, gastrointestinal and other. In respiratory, there can be a pneumothorax, nasal polyps can occur, hemoptysis due to invasion of small arteries near the bronchi. Respiratory failure can also occur because there will be decreased level of oxygen or there can be hypercapnia. A gastrointestinal tract may cause malabsorption and steatorrhea, because the sodium and chloride, wherever the sodium chloride goes, the water goes with it. It attracts water, so it will take away all the water from the intestine. So intestinal obstruction can also occur, and biliary cirrhosis and portal hypertension, gallstones can develop. Other complications like diabetes, because of the involvement of pancreas, the pancreatic ducts are blocked and it may lead to autophagy, and autoimmune pancreatitis can also occur. So diabetes can occur in 25% of adults. Osteoporosis can also occur as a complication. So the diagnosis is by sweat test. Sweat sodium and chloride levels are checked, and if they are more than 60 millimole per liter, then it's a diagnosis of cystic fibrosis. Genetic testing for cystic fibrosis mutations will be a definitive one. The treatment involves pancreatic enzyme replacement, fat-soluble vitamin replacement. Chest physiotherapy is also essential to help the mucus remove from the tract. And vaccinations, influenza yearly and pneumococcal 5 yearly. Antibiotics should be given for the recurrent infections. inhaled recombinant human deoxyribonuclease enzyme, which breaks down DNA in respiratory mucus that clogs the airway, can be used. So this is the end of the video. I hope you learned something from it. If you do, please like my video and share it with your friends and subscribe to my YouTube channel. Thank you so much for watching.